Let's see if I can find myself here. Okay, so one of the questions, what you were talking about, is shoulder pain after surgery. So one morning I came in to see a very polite, very nice patient, and I said, "How are you doing this morning?" She said, "Dr. Rutledge, you are such a wonderful doctor, and I want to thank you for doing my surgery. I just have one little thing. I think you broke my shoulder." And she just said this, just the most polite, nice lady, and just, and I said, I laughed. She says, "Look, I'm not angry at you. I understand these things can happen. Maybe you dropped me when you moved me from the table." I'm just laughing. I go, "No, we didn't break your shoulder, So she says, "Look, I'm not going to sue you. It's just these things happen in a hospital. A broken shoulder can be fixed. I had a broken shoulder earlier this year, and I can tell you this feels like a broken shoulder." So what I'd like to do is explain her pain, and I can tell you that we did not break her shoulder. But she felt, and she was certain of what a broken shoulder felt like, and she was certain she had one. And in the midst of all that, she was still nice to me, which is, I don't know, I'd be kind of angry if the doctor dropped me. But anyways, so why is it that we have this shoulder pain after we do this abdominal surgery? And the reason is the way we were created. Our fingertips are filled with thousands of different kinds of nerve endings. So if you touch things with your fingers, you can tell a lot. You can tell sharp and dull, and soft and hard, and wet and dry, and warm and cold, because of all the thousands of nerve endings in your fingertips. On the other hand, when God was creating the abdomen and the chest and the left shoulder blade, he said, how many nerves do these guys really need? And so it turns out that the nerve that gives sensation to the abdomen, the chest, the heart and lungs, and the shoulder blade are all pretty similar. They're all kind of on the same trunk. So have you ever heard of somebody having a heart attack and sometimes their arm hurts? Okay, because all of those nerves are in one nerve. God didn't think we needed to keep a lot of sensation going in the abdomen and the chest, and in fact just used one of the nerves from your shoulder blade. So it's called referred pain. So somebody, for example, with a ruptured spleen, a broken spleen, will often say, "Boy, I have terrible pain in my shoulder." And this lady had such pain, she actually thought that she had a broken shoulder, and she knew what a broken shoulder was like because she had one earlier that year. And the sensations are the same, but one is because of pain, irritation, surgery, bleeding in the abdomen, and the other is an actual broken shoulder. So your feelings are not got anything to do with your shoulder. It feels like your shoulder, and some people put heating pads on it, they'll do exercise and things like that. None of those things will make any difference. It's the reason for your pain is a masked man stabbed you 5 times, crushed your stomach, stapled it, and sewed on it, and that leaves behind the response to irritation. And your brain can't differentiate that location just because of the way God created those nerves.
Okay. Explain.
But it should get better. That's the good news.
Yeah,
and also the good news is we did not break your shoulder.
Yeah, thank you. Appreciate that.
Whew, my malpractice attorney is going, "Whoa, good news." But it's real common. The other common thing we hear all the time, and I'm kind of getting ready to give up on this, but everybody says, "Oh, I have gas." "Oh, I have gas." "Oh, the surgery is fine. I just had this really bad gas pain." And we like to explain to you, you don't have any gas pain at all. The problem is, again, when God created us in the abdomen, he put behind nerves that have a limited vocabulary. Your nerves in the abdomen, for example, can't hear. The sound doesn't affect those nerves. The nerves in the abdomen can't see. Okay? The nerves in the abdomen can't tell the difference between warm and cold. Okay? But they do sense gas. So it's a little bit like the old TV show, Lassie. You remember that? Mm-hmm. And Lassie would come up to Timmy and go, "Ruff, ruff." And Timmy would go, "3 teachers have fallen into mine and they need insulin?" "Ruff, ruff." And you're going, the dog only knows how to bark. Or like a baby. When a baby cries, what are they crying about? Is it food? Is it a dirty diaper? Is it they want to move? What is it? So they only have certain words. So the nerves in the abdomen of our patients have a very limited vocabulary. So they send a signal often to our patients saying gas. but it's not gas, it's surgery. It's the masked man who crushed it. So some of our patients will say, I need to take a Ducalox suppository for the gas. Or I need to, can I take some Gas X for the gas? And so none of those things help because it's not really gas that's causing the problem. And so your shoulder should be okay. And the diarrhea should get better.
Good.
Other questions?
Probably only one, and this was back when I had my first surgery. Afterwards, it was like I would eat ice all the time. All the time I would eat ice, and I wondered if that maybe stretched out my stomach.
No.
Okay.
No, that's a good question.
I do know that I'm anemic.
Yes,
my
that's why the
always
ice.
Tell me that.
That's what the ice is about. Have you had intravenous iron?
I have not, but you mentioned
Venifer.
that, and so I'm definitely going to look into that.
Yes, and I think what you need is, and this is actually another kind of little